Hi, I'm Dr. Steve Lininger. Today I'm going to be teaching you a little bit about the different phases of degeneration in the neck and back. So a normal piece of the spine, anywhere you remove it, this is an example of a joint. You have right here, you have a disc, you have another disc here. These are the bones, and these are the nerves. Okay, the yellow parts. This is the spinal cord coming down from the brain, sending information and energy through every nerve in the body. And all the parts of the body are controlled by nerves that communicate back and forth with the brain. So basically, the lower back or the neck, they move in like this. So that you bend this way, they move like this. You bend this way, it moves like that. You come forward, it goes like that, and then backward like that. So that's how it should move. It should be very articulate like that. Now, the problem becomes when the spine degenerates. So there's a normal one, and the worst condition I've seen in my office is something like this. So if you see the difference between the bones here and this bone, it's very clear to see the level of degeneration. Now, if I turn it this way, you can see the degenerative disc changes. This is a normal disc and a normal annulus in the disc or nucleus, and look at the difference there. It's very dry, it's cracked out. If I open this one up, you can see that it's real thin compared to this one here. So this is a phase 3, or the worst level of degeneration that can occur where the patient hasn't typically lost too much mobility. There is a phase after that where the bones actually grow into one another and fuse. At that point, the patient's typically going to have heart and lung problems and mobility issues. Now, the different phases of degeneration, first you have the normal, then you have a phase 1. Okay, now in phase 1, typically you have very brief thinning of discs. Cortices here are starting to thin. And then in phase 2, it looks like this. So again, the disc thins. You can have, this is a disc bulge or a herniated disc that comes out here. You can see from the side too that the holes are starting to close up around the nerves here. And that's where you get the nerve irritation and inflammation of nerve tissue. By phase 3, that nerve has completely been closed up around it. Now, the only way to tell if you're in phase, well, typically if you're normal like this one, you're not going to have symptoms. But the real only way to tell what phase you're in, 1, 2, or 3, is through the use of x-rays. And that's what we do in my office. Typically we do an examination, evaluation of the area, and then in-house x-rays on the first day. I'm Dr. Steve Lininger. I hope you learned a little bit today, and talk to you later.